Hey girl, hey. Okay, so I'm back. This is Dr. Tasha. If you are not familiar, welcome to my channel. Thank you so much. The only thing that I ask is that you guys make sure you are subscribed to my channel so that you don't miss any videos. Like the video. I need you to like the video before you watch the video, honey. Like the video so you do not forget. And make sure you pass it along to anybody who can use this where it could be of help, because that's my goal, guys. Like, my goal is to make sure that we're getting this proper information, in a space that we're being able to empower and help ourselves. And when you go to the gynecologist, that you're able to say, no, I understand this, and I understand, and not in a confrontational manner, but just to advocate for yourself and make sure that you're, not going round and round and round with issues that could be easily resolved, especially if you know a little bit, and you might end up kind of knowing a little bit more than your gynecologist. I don't know. But so today I want to talk to you guys about cervical infections, aka cervicitis. And we have talked about this before, but I've talked about it bit by bit. I think I did like a series on Instagram, but I never really put it in a YouTube video, I do not think. Okay. But let's get into it. Okay. I think that sometimes a little bit of knowledge is can be a little bit dangerous and can be a little bit offensive sometimes to healthcare providers. So what I want to do is I want to talk about what exactly the cervix is, where exactly the cervix is, what is happening with these cervical infections, how are you getting them, how can you prevent them, how are we treating them, and just how to understand them in their context. Because whenever we say infection, and then you say a cervical infection that has anything to do with sex, providers are gonna be like, oh, it's sexually transmitted. No. Okay. So want to kind of just go down that rabbit hole of what the hell is it? Okay. So first of all, for starters, your cervix sits at the top of your vagina. It is the lower part of your womb. It separates the inside of you from the outside of you. All right. And the way that I would like for you to, it's the thing that kind of holds the baby in. Like when we stick their fingers in and they're checking to see if you're dilated, we're checking your cervix. And the thing that I kind of want you to visualize the cervix is like a big sponge that sits at the top of the vagina. All right. And go with me on this. Okay. And people tend to think, and this is an aside, people tend to think that semen is just sperm. It is not. Semen is sperm and urine and blood and pus. Yeah, girl, sounds delightful, doesn't it? Anyway, your cervix, and it's held together like real tight, like pinpoint. The only thing that it will allow through is sperm, which is microscopic. Like you can't see it. Like it's super duper small. That's the only thing that it will let through. But the urine, the blood, and the pus are caught by your sponge, aka your cervix. And again, this is not directly how it goes, but this is how I want you to visualize it, because this is low key how it happens. And as your sponge, as you get an overgrowth or so much of stuff in your sponge, and usually what we're looking for are two specific types of infections called ureaplasma and mycoplasma. And I'm going to go over those in a second, but let me finish this thought. So as your sponge gets fuller and fuller and fuller and fuller, for the reasons we'll talk about in a second, you develop these infections. They can develop into infections. And usually it doesn't necessarily cause an issue, but I am of the mind that when you have cervical infections that are untreated, it ping pongs. Meaning, like, if you don't treat the cervical infection, the vaginitis, and then the vaginitis will go away, then the cervical infection, a certain bop. And so you basically have to know what you're treating and treat both things, okay? Now, that is understanding the cervix, what it is, and kind of low-key how it functions, okay? Let's talk a little bit about ureaplasma and mycoplasma. Those are the two infections that we look for. And there are different types of mycoplasma, because some mycoplasmas are really associated with vaginitis, others associated with cervicitis, but it's mycoplasma and ureaplasma. Now, with women, you know, like our vagina is here, our pee hole is like right above the vagina. So oftentimes anything that's going to be in one, oftentimes can kind of ride its way or kind of like be in the other, if that makes any sense. And so when we have low-key ureaplasma or mycoplasma, they can be found in the vaginal area or in the the urine area, and we call it urogenital. It can be found down there in very low numbers, and it doesn't really cause an issue, right? But if we are overabundant in it, if it's too much of it, if our immune system is compromised, then it can get in the space of causing infection. And the biggest thing with mycoplasma or ureaplasma, it plays a role in preterm labor. Yes, preterm labor and preterm delivery. It plays a role in that. So I am very, like, when I used to deliver, shout out to me for not doing that anymore, but when I used to deliver, I was very, like, dogmatic about cervical infections, because they find it a lot of times in amniotic fluid. And, I used to be, like, on it in testing all the time. Now, I want to talk about the testing let's talk a little bit more about mycoplasma and ureaplasma. So first of all, technically, do males carry mycoplasma and ureaplasma? Technically, they do. But it's not like it's considered a sexually transmitted disease. It is not. Don't let any doctor make you think. I always say it is sexually associated. He did not do anything wrong. If he has it in his urogenital tract, he just has it in his urogenital tract. If you decide to have unprotected sex with him, okay, you decide to have unprotected sex with him, sis. We're not judging. We're trying to fix you. We're not judging you. So I don't counsel my patients on that it's sexually transmitted. I'm like, it's sexually associated. When we think sexually transmitted, it's like, I need to get treated, he needs to get treated, he did something wrong, who is he messing? And that's not the connotation of it. I will usually say, for women who are having unprotected sex, whatever relationship you choose to be in, be it marriage or be it monogamous or be it whatever, doesn't matter to me. I always call it an occupational hazard. So if you're having unprotected sex and you are exposing your cervix, mycoplasma and ureaplasma are occupational hazards. It is what it is. When I find it, I treat it and I move on, and it's not like it requires a whole lot of counseling, although we generally tend to have this talk. But as far as the ureaplasma and the mycoplasma, it is what it is. How will you know if you have it? 9 times out of 10, unless you have had it for a while, unless it's really, really, really abundant, 9 times out of 10, you won't know. You won't have any signs or symptoms. It's so funny because every time I diagnose you, patients are like, what? I got what? You didn't know you had it. You had no symptoms. I treated it. And now you're like, I still feel the same symptoms are there. Girl, it wasn't no symptoms to start with. But I just go with it and I just retreat sometimes. So the thing is that because, and this is what I really want to get across, because it shows up on your test, right? And it's treated. Please stop going back to the doctor and say, is it gone? Is it gone? Is it gone? Because it may not be. It could be a normal part of your again, urogenital tract, but like I said, when it gets to a place where it's a lot of it and it's of abundance and it's causing infection and different things like that, then it needs to be treated. But please, there's no need to follow up. Treat it and change your lifestyle accordingly. If you're not going to change your lifestyle, meaning having unprotected sex, meaning putting things in your vagina in general, your cervix, like I said, that sponge, it sucks up everything that's not sperm. That's lubricant. That is chemicals from your tampons. This is why I always recommend chlorine-free tampons or raw cotton tampons. None of the chemicals from that boric acid crap. All the things, suppositories, anything that you put in your vagina, oh, that cervix is going to suck it up. The more things you put in there, including semen, the more things you put in there, the more frequently you put them in there, the fuller your sponge is going to get, and the quicker you're going to move toward the infection side versus kind of it just being there type of a picture. So be mindful. Please stop going back, because if they find it, there's no need to take 10 and 20 rounds of antibiotics. Okay, it's there, but the reality of the situation is, because it's there doesn't mean you're, how can I say it, to have it and to be infected by it are two different things. So it can be present and just be low key and not really causing any issues, because most of the time, again, it's asymptomatic. But again, if it's like, I just keep getting this weird discharge, I keep getting this weird drainage, I have a smell. When I think, and when patients tell me, I'm like, well, what does it smell like? And they get all funky and like, I don't know, it just stinks. No, let's talk. What does it smell like? Because oftentimes if you have a cervical infection, it's going to be more musty. It's going to smell like pee, or it's going to be musty. Like one person said cat pee. That was a pretty extreme case, and I did smell what she smelled, and that was pretty extreme. But oftentimes it just smells like you can't get fresh. Like you smell stale. Like you're like, damn, I just got out of the shower. Why I smell like I just came from the gym? Like what is going on? I don't stink, but I just smell sweaty, and I know I'm not sweaty. Oftentimes that's when you have a cervical infection, okay? So those are some clues. Those are some keywords that I listen for. But again, just years and years and years of examining people in training. I know what it smells like. When, yes, I do the exam, I'm a big whiff tester. And that means I'll do your cultures, and then I smell. And when I smell, which may sound pretty gross to you, but that leads to my diagnosis, and I'm right probably about 95% of the time. When I smell, I'm able to pick up what it is you have. And that's why my motto is always like, if you got it, I'm going to find it. And it's true. So at the end of the day, please don't be obsessed with the fact that you have ureaplasma, you have mycoplasma, you've been tested 8 times. Stop. That it does not require that, okay? What it requires is treatment. Once it's been treated, you're good, and at least you're good for a while. If you start smelling that smell, maybe you seeing some like really mucousy discharge. My discharge is changing. Something's funny. I have a funny odor. Then maybe it's like, okay, let us, take a look, and maybe the, cervix needs to be treated again. But please don't follow it up so hard like you would follow up gonorrhea, chlamydia, trichomonas, because they're very different, okay? And I want it to be very clear with that. I don't want you guys to be obsessive about something that, may be okay. Now, as far as treatment is concerned, I've gotten so many, oh, my doctor treating me with this, my doctor treating me with that. The treatment is azithromycin. It's 2 pills one time. That's it. It's azithromycin. Get those 2 pills. Have you some lunch. Take the pills. Make sure you take them with food because they stand on business, okay? And you will throw up. If you take the pills and you're able to keep them down for like an hour, hour and a half, maybe 2 hours, you're good. If you take them 30 minutes later, you threw up, you need to be retreated. Now, if you're somebody who happens to be allergic to azithromycin, then you can do what the doctors are doing, 5, 7, 10 days, whatever it is they're choosing to do, of doxycycline. But that's like a long treatment, but it works. But again, azithromycin is what we call the gold standard of treatment. And oftentimes, anytime you want to treat the cervix, it's going to be azithromycin. So if you talk to your doctor, you come back and the first thing they give you is doxycycline, you might want to say, hey, can we try azithromycin? Because ain't nobody got time to be on nothing for 5, 7 days. And these are really strong antibiotics. Ain't nobody got time to be on that for 5, 7 days, honey. And you can, just take these 2 pills and be done with it, okay? So if you say, well, what can I do to prevent developing, a cervical infection or worsening of my cervical infection? Well, my recommendation is going to be have protected intercourse. Have protected intercourse. If having protected intercourse is not a reality, then you also kind of have to check on the health of your partner. How's he eating? What's he doing? Is he taking medications? Is he taking supplements? Does he have medical conditions that may or may not be being addressed? Y'all got to start asking questions. And this is no disrespect to anybody, but we really cannot have a pick-me mentality. Like, we have to start asking questions because his health is your health, especially if you're going to have unprotected sex. You dig? Okay. Also, keeping as many messes out of your vagina as possible, unless you have a medical condition, like pregnancy where you have to put progesterone inside the vagina or whatever the case may be. You are using estrogen inside the vagina for vaginal atrophy or some other condition. Unless you have a medical condition where you're putting things into the vagina, don't put things into the vagina, okay? And that includes if you're going to use toys, make sure your toys are clean. Make sure you clean them with a soap that you will wash your body with. And if you know it's Dove White Bar Soap or Clean and Cute Body Wash Bar, those are the only 2. Clean your sex toys with those and let them air dry and then put them away. Make sure your things are clean. Make sure you're not using, I told you, all these supplements and these pearls and beads and boric acids. It just sickens my whole soul. But anyway, judge not. We listen, we don't judge over here. So definitely that is something to be mindful of too. And again, the chemicals in tampons. So anything that you put into your vagina, you have to be very careful because your vagina is vascular. So anything you put into your vagina is a straight shot into your bloodstream, and that cervix picks the actual substance up and does what it does. So just be very careful when putting things into your vagina or introducing things into your vagina, because it can hasten you getting a cervical infection, or worse. Okay, so I hope that this video helped. I just want you guys to understand, yes, cervical infections are out there. They're different than vaginal infections. I wanted you to understand how you get them. It's not anything sexually transmitted. You didn't necessarily do anything wrong, but I don't want you guys to get on a merry-go-round of providers who may not be real proficient or have a strong understanding of cervical infections, and you're like, I want to be retreated, I want to be retreated, and they're just retreating you, and you're on this gerbil wheel of being on very strong antibiotics it's not necessary. So a treatment, yes, but it doesn't need to be treated and retreated and retested and retreated. No, that's not. You find it, you treat it, you change some behaviors if you can, and you just watch for the things I'm talking about, particular odors, or if your discharge changes or something, or it's like I got vaginitis and I did what I was supposed to do. I followed the hygiene rules that Dr. Rogers gives. I'm using what I'm supposed to be using. I'm having protected intercourse, using the condoms I'm supposed to use, and I still got this vaginitis. What is going on? That's when you say, I wonder if my cervix is out of control or infected, and it's causing this ping pong effect with the vaginitis. But don't be so obsessive about it that you get into a non-productive wheel of constantly being tested and treated and tested and treated. Please don't do that, guys, okay? And for my pregnant ladies, and this is a very difficult one because, again, like we're saying, it can be found in what we call the urogenital tract. We treat it and then we kind of let it go. But if it's a situation where it's an abundance, yes, it can cause preterm labor and delivery. So the question is, well, how do I know? I didn't know I had it from the beginning. So how do I know if it's an abundance? How do I know if I'm at risk for preterm labor, preterm birth? Well, again, it's something you want to definitely talk to your provider about. I used to be rather obsessive about it. If somebody had a history of preterm labor, birth, or if I would look at the ultrasounds and notice that the cervix is shortening, anything that would kind of clue me in, I would look at the discharge and be like, this discharge looks a little interesting. Then I probably would be a little bit obsessive about it and treat it once a month. So I just give 2 pills once a month, and that would be it, just to kind of keep it under control so that it didn't run rampant enough to cause any issues that may not be seen or addressed until after the fact. And that's just how I did things. I was a very anal obstetrician, and I can't, because if you ask this of your obstetrician and they don't do it, don't think that they're doing something wrong. And maybe you can even kind of have a conversation and say, hey, listen, I would be more comfortable with this. I have a history of this, or my cervix is shortening. We can't treat everybody all the time for everything, but if there are points of worry or points of caution that you have about preterm labor and delivery, then certainly it's a conversation you should have with your provider and see if you can come to a common ground with, yeah, well, it may not be anything, but if I'm willing just to take these 2 pills once a month to keep it under control, just in case, are you willing to give it to me? And again, everybody does things differently. If they say no or they don't feel like it's necessary, don't feel like they're doing something wrong. Just say, yeah, I get it, and you may not feel like it's necessary, but humor me. Humor me. The pills are not going to hurt me. I'm not allergic. They're not going to hurt my baby. Just humor me and please give them to me. And that's what I would offer you as a suggestion. But again, every provider does things differently. They're not wrong to not give it to you, and the amount of times that you're going to see it truly cause preterm birth, preterm labor and delivery are minimal. But if it's even one case and you're that one case that we can prevent, why not, right? So that's the whole that's the concept of the whole preterm labor and delivery when it comes to cervical infection, cervicitis, ureaplasma, mycoplasma. Okay, so guys, I hope this helps somebody. I hope it blessed you all. And for all my ladies who are just on that gerbil wheel, girl, get off that wheel. You all right. You all right. Okay, anybody gave you nothing, you ain't gonna give nobody no. Girl, you okay. Okay, I just want everybody to settle down, but I just want you guys to understand that these infections are out there. It's not just yeast vaginitis. No, it's other stuff that happens, and I just want you guys to have an open eye. And maybe if you have been suffering for something for a long time, maybe something is being missed, maybe something's not being seen. And for my ladies who could describe their discharge odor, it's musty, it's sweaty, it smells a little bit like pee. So in your mind, it's like it smells bad, so it must be vaginitis. No, it's other stuff. So sometimes even giving your providers these keywords can kind of help them out as far as treating you and make sure you're fully treated. And that's my goal, just to make sure everybody is empowered and that they're comfortable with their treatment and that you guys are being fully treated. So thank you so much for listening. Thank you so much for joining for another podcast Thursday with Dr. Tasha. And I'll see y'all soon. Have a safe weekend.